Dr. Leonard is a licensed clinical psychologist and works as the executive director of clinical strategy at Rogers. In this role, she oversees treatment standardization, adherence to treatment protocols, and efforts to improve patient outcomes. Outside of work, she is a wife and a mother to 2 beautiful children. Please join me in welcoming Dr. Leonard.
Hi, everyone. Thank you for being here today. So we've all been through a tough couple years with the uncertainty of the pandemic impacting our own health potentially and the health of those that we love. And now we have this chance to hopefully reemerge out of the pandemic and really think about the direction we want to take moving forward. So I've been asked today to speak a little bit about some of the strategies that we use at Rogers to give you a taste of the experience that our patients have in our care. So the Oxford Dictionary defines self-awareness as conscious knowledge of one's own character, feelings, motives, and desires, and that is part of our theme for this event today. Self-awareness overlaps with many of the important strategies we use in treatment to ensure that our patients have insight into their own current symptoms and identities, as well as insight into who they want to be moving forward into the future. One of these strategies that we use is mindfulness. So we're going to talk a little bit about mindfulness today. Mindfulness is a strategy that can help all of us improve self-awareness, especially as it relates to our current thoughts and feelings. It involves paying attention fully and with purpose to what we're doing. Practicing mindfulness can help increase the richness of experience and change the relationship that we have with different thoughts and feelings. By noticing and accepting these challenging feelings and thoughts, almost like a curious observer, we can gain perspective and choose not to let those difficult thoughts and feelings control us. So many of you took a quiz to just see how much we know about mindfulness, so thank you if you participated. I'm going to go through what the questions and answers are, and then along the way just give a few tips related to mindfulness too. So the good news is that you all were pretty impressive and scored really well. For those type A people out there, you all did a very good job, all above 90%. So the first question asked about how to accurately describe mindfulness. And the best word here was noticing. 94% of you got that one correct, with the second most common answer being analyzing. So we often can get caught up thinking about the past or worrying about the future, which comes at the expense of now. So how are we noticing what's going on around us, especially as it relates to the things that really matter to who we are? So a takeaway tip related to this is to try to be fully present and engaged in the moment. And so I'd like to invite you to close your eyes. And if you're not comfortable with that, you can just gaze at a spot on the floor. And I'm going to ask a few questions. So I'd like you to try to think about the room that we are in. What color do you think the walls are, or the ceiling? How many windows are there? What is on your table? What about the people at your table? What do you notice about them? I'll give you a second to think about that. All right, so you can open your eyes. How did you do? How attentive have you been to your surroundings? One of the things that can be helpful in really noticing and taking in your surroundings is to pay attention to each of your senses and think about what some things are that you can see, hear, smell, taste, and feel in any given moment to help you really connect with that moment. The second question asked about which of the following wasn't mindfulness, which the correct answer there was increased emotional distress. Sometimes we can be more in touch with distress if we're being mindful, but often over time, Practice of mindfulness can help us feel less attached to those moments of distress and gain perspective. So 91% of you answered that one correctly. The second most common answer was improved immune functioning, which actually is a benefit of mindfulness. So the more you practice mindfulness, the healthier you may be, which is supported by research. So mindfulness can reduce that emotional distress by helping us gain that distance and perspective. And often in treatment, we will pair mindfulness strategies with work towards identifying values and goals for the future. So the takeaway tip for this one, I think all of us kind of periodically can benefit from just like looking at how we're spending our time, how we're making decisions, living our lives to see how that aligns or doesn't with the things that we value. What are the core pieces of who you are and who you want to be? And how do the behaviors you're engaging in support that? And then, make some small adjustments over time, as we all need to do based on that reflection. The third question was about which experience described mindfulness. And the correct one here was while eating your favorite meal, you close your eyes and identify the unique flavors. I think we're often very busy, we multitask. The second most common answer was actually keeping tabs on the Brewer game while doing something else, which I can understand. Wisconsin sports are important, but if you're watching the Brewers, you should really be watching the Brewers and not multitasking. So here, the takeaway tip is to just pick an experience. It's nice to do this with something positive, like a favorite meal, a favorite song, an interpersonal experience with somebody else, a conversation with a friend or a loved one, and really notice all of the components. What are the unique instruments contributing to the song? What can you pick up on in the affect of the person you're with that maybe you wouldn't have noticed if you were distracted or looking at the score on your phone, those kinds of things. So pick an experience to try that with and just notice what happens. So then the last question was to be mindful includes being aware of your feelings, and then what do we do with them? And if we're being mindful, the correct answer here is to accept them. A lot of the pain and suffering we experience is by trying to control those feelings, trying to not have them or push them away. So think about a challenging emotion that you've experienced recently. Where did you feel it in your body? If you could give it a shape or a size or a color, what would it look like? And what is it like to really just kind of observe and accept that for what it is versus do other things to kind of get rid of it? What are the urges that you have maybe to try to push those thoughts and feelings out of the way? So next time you have that feeling, when it comes up, when it's a really difficult moment, maybe try that. Try to just label it and invite it in and see what that feels like if that's something you haven't done before. I'm going to wrap up here by thanking you all for being here for this important event to support the foundation, which is one of my absolute favorite parts of working for Rogers. The work that the foundation does is so incredible for our patients. So thank you all for your support and for being here today, and enjoy the rest of the event.